So today we're going to be talking about the difference between aplasia and hypoplasia. These are very commonly confused, especially when it comes to exam purposes. So this video is extremely high yield. Be sure to also check out our website at thehealingpowerofnature.com to make medical school easy breezy, and also to check out our Pathology 101 book. By the time this video ends, you should understand several different things. You should be able to understand the difference between aplasia and hypoplasia. These are commonly confused, especially on examinations. So you're going to go over the definitions and correlations between them, high yield examples. We'll also talk about some pathologic manifestations. When it comes to these pathologic manifestations, especially in these beginning videos, it's just important that seeds are being planted. So don't get discouraged if you don't know everything we're talking about. The more that you hear the information, the more you go over the information, the easier it will become, especially with time. So we're also going to go over some clinical relevance, and we'll also dive into some USMLE practice questions to help solidify your knowledge for the long term. So aplasia, the definition, aplasia refers to the failure of cell production during embryogenesis, leading to the complete absence of an organ. Recognizing that it is complete absence of an organ. The etymology, A means without. Oftentimes, if you just go over what the word means, it will help you understand exactly the different diseases we're going to be talking about. So A means without. Plasia means formation, so it means without formation. One way you can think about aplasia, think of aplasia as a house blueprint missing an essential room. All right, so the workers went to go build the house and the blueprint wasn't there, so the room never got built. So, for example, in biologic terms, the organ never forms because the instructions or the blueprint were incomplete from the start. All right, so the blueprint could, in biologic terms, represent the genetic or embryologic instructions. So during embryogenesis, the development of organs depends on specific genetic signals, for example, transcription factors and signaling pathways. If you don't have the blueprint or the instructions, cells cannot build their room, leading to basically aplasia without formation. So pathophysiology, aplasia occurs when embryonic development is halted, often due to genetic mutations like we just talked about. However, it can also occur to environmental factors or harmful substances or factors like drugs, infections, or toxins that disrupt normal embryonic or fetal development, potentially causing birth defects. Examples include alcohol or infections like rubella. So clinical and high yield examples. Like I said before, if you don't know everything we're talking about, it's okay. It's just important that you plant the seed. These are very high yield examples. They will show up over and over and over again. So you might as well start now. Start planting the seed. So first, thymic aplasia, or also commonly referred to as catch-22, and I'll explain why. So what is thymic aplasia? Well, we know it's aplasia without formation of the thymus. All right, so failure of the third and fourth pharyngeal pouches in development lead to absences of the thymus and parathyroid glands. Clinical features would include immunodeficiency due to T cell deficiency because the T cells mature in the thymus. So the mnemonic that people often use is catch-22. What does catch-22 stand for? Well, cardiac defects, abnormal facies, thymic aplasia, cleft palate, and hypocalcemia, and the 22 representing the 22q 11.2 deletion. So this is an easy way for you to remember it. Second, unilateral renal agenesis, meaning without creation. Unilateral renal agenesis means one kidney fails to form during development. The body usually compensates with the remaining kidney growing larger. Clinical features, they're often asymptomatic, but compensatory hypertrophy of the remaining kidney. So commonly, there is a bigger kidney on the other side. Additionally, aplastic anemia or pyrovirus B19. This is a commonly tested example. Remember pyrovirus B19 from the beginning. Aplastic anemia. Well, we know aplastic without formation, anemia without blood. You can't form blood. Failure of hematopoietic stem cells, which is considered the mother of all cells to produce blood cells, happens when your bone marrow, the blood cell factory, stops making enough blood cells. This affects red blood cells, white blood cells, and platelets, leading to symptoms like fatigue, infections, and easy bruising. Triggers of aplastic anemia are acquired and occur later in life. So aplastic anemia are acquired and occur later in life due to environmental or autoimmune drugs or toxins, medications like chemotherapy, or toxins like benzene. Additionally, infections, viruses like parvovirus B19. Like I said, remember this one, but also it's very important to keep in mind Epstein-Barr and also HIV. Genetics as well, conditions like Fanconi anemia, and additionally, congenital aplasia of the radius. Congenital, meaning of birth, aplasia without formation of the radius. So causes, genetic or harmful substances to the body. Clinical features, absence of the radius bone in the forearm, often seen with other congenital syndromes. What is hypoplasia? Hypoplasia refers to reduced cell production during embryogenesis, resulting in a smaller than normal organ. So it's still there, it's just smaller. It's hypoplasia. So if we break this word down in the etymology, hypo means under. I gave that one away. You should know this one. Plasia, good job, means formation. So a metaphor of hypoplasia is like baking a cake, but running out of batter, or another essential ingredient like eggs halfway through. Because all of the necessary ingredients weren't there, some layers form in the cake, but the cake is smaller and underdeveloped compared to the original plan. So hypoplasia results from insufficient cell proliferation during critical periods of development, often due to genetic or environmental insults. So, number one, streak gonads and Turner syndrome. What is this? Causes loss of one X chromosome, specifically the 45X karyotype, leads to improper ovarian development. Without two X chromosomes, ovarian follicles cannot develop, leaving the ovules as non-functional fibrous streaks. Now, next, pulmonary hypoplasia. So, pulmonary hypoplasia. There's below growth of the pulmonary system. What causes this? Inadequate lung development from limited space or fluid in utero. Low amniotic fluid, which can prevent the lung from expanding. Clinical features would be severe respiratory distress at birth, low surfactant and lung volume. Potter is a commonly used example to remember pulmonary hyperplasia. So what does Potter stand for? Pulmonary hypoplasia, oligiohydramnios, which means low amniotic fluid, twisted face, twisted skin, extremity defects, and renal agenesis. Focus on the role of the amniotic fluid in lung development and recognize this is neonatal respiratory failure. Enamel hypoplasia. What is this? Below growth of the enamel. Causes deficient production of enamel during tooth development, often due to malnutrition, childhood infection or fever, or also excess fluoride during tooth formation, leading to fragile teeth and increased risk of dental caries. Hypoplastic left heart syndrome causes failure of the left-sided cardiac structures like the left ventricle, the mitral valve, or the ascending aorta to fully develop. Basically, what happens is the left side of the heart cannot pump blood efficiently, leading to systemic hyperperfusion and cyanosis. The clinical features: poor oxygen delivery due to inadequate system blood flow, or cyanosis. Here's a simple chart that breaks down the two so you don't get them confused. I would recommend taking a picture of this or keeping it close with you. So the definition of each. So A, like we learned, is without. So the definition of aplasia is complete absence of an organ. Hypo, like we learned about, means below. So it's incomplete development of an organ. The pathogenesis of each: aplasia, failure of embryogenesis. Hypoplasia, reduced cell proliferation. So like I said, A, absent, hypo, below. So here's a couple different things. Aplasia, recognize examples like thymic aplasia, DeGeorge, and aplastic anemia, which integrate embryology, hematology, and immunology. These will continue to be high yield for you. Hypoplasia, commonly tested in conditions like Turner syndrome, streak gonads, like we talked about. Remember Catch-22 for DeGeorge syndrome, and Potter for pulmonary hyperplasia. All right, let's go ahead and jump right into these questions. I'll give you some time, but I will always recommend that you read the last sentence first, then your question answers, then read the entire question. So I'll give you some time to answer these questions and we'll come back. Dysplasia is the correct answer. Why was it not B? Hyperplasia involves increased cell number but does not show disordered growth or nuclear abnormalities. Why not C? Carcinoma in situ is irreversible, high-grade lesion. Why not D? Metaplasia is a change in cell type, not disordered growth. Okay? Give you some time with question number 2. All right, the correct answer was B. So why was it not A? So renal hypoplasia is unrelated to DeGeorge syndrome. Why not C? Thymic hyperplasia is not characteristic of DiGeorge syndrome. Thymic aplasia is, okay? This is a great example of how they try to trick you up. Why not D? Dysplasia does not apply here. Aplasia is the correct term. And lastly, one more question. All right, if you chose B, you were correct. So why not A? Klinefelter syndrome presents in males and is associated with gynecomastia and testicular atrophy. Why not C? Androgen insensitivity syndrome occurs in XY individuals and includes female external genitalia with undescending testes. Why not D? Congenital adrenal hyperplasia involves ambiguous genitalia and virulation, not streak ovaries. I know that it was a lot and some of this might have been confusing for you. That is okay and completely normal. The idea here is you want to listen and go over the information as much as possible. We'll continue to dive deep in all of these concepts. I recommend that you visit our website at the www.thehealingpowerofnature.com for our complete Pathology 101 book, which goes over every single detail you need to know about pathology to make medical school as easy as humanly possible. Thank you for supporting us. Don't forget to check out our Patreon channel, and I'll see you next time.